everyone, and thank you so much for taking time out of your day to join us for the NeedyMed special topic webinar, Ways to Minimize the Financial Impact of Cancer, presented by our partner, Triage Cancer. So my name is Carla, and before we kick off today's presentation, I'm going to take a few moments to offer some tips so that you can make the most out of it. First of all, if you do have questions, we encourage you to type them into that questions, or for some of you, it's the chat section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't get the chance to answer your question, we'll follow up with you by email. But of course, we will also provide the contact information for Triage Cancer and NeedyMeds and encourage you to reach out to them if you need an immediate response. Also, the heads up that today's presentation is being recorded and will be converted into a video and uploaded on the NeedyMeds YouTube channel. I encourage everybody to subscribe. That way you'll be notified when new webinars, videos, and presentations are added, and you won't miss out on anything. Also, as you saw on the first slide, we did upload some materials we thought you'd be interested in the handout section of your GoToWebinar control panel. So go ahead and check out that section. So with that, let's also get out of the way just some info about NeedyMeds. For those of you that are not familiar with who we are a national nonprofit that was actually founded about 25 years ago by a retired family physician, Dr. Rich Sagal, who's still our president, and his friend, Libby Overly, who was a medical social worker. What you're looking at is our mission statement, but simply put, NeedyMeds connects people to programs that help them afford their healthcare expenses. And we do that not only free, but also anonymously through our website, needymeds.org, and our toll-free helpline, which is 1-800-503-6897. And I hope you take the time to check out our website when time allows. And again, don't worry, we'll have the contact information for our organization up at the end of the presentation as well. For now, I want to just take a moment to also point out a screenshot of our homepage. I like to put that up because really our website is the face of our organization, and it gives me an opportunity just to highlight a few things, such as if you are looking for healthcare savings options, check out the aptly named Healthcare Savings tab. Right next to that is the Education tab. Again, when time allows, check it out because that's where you can sign up for other upcoming webinars. You can sign up for email alerts about program changes, newsletters, etc. And the last thing I want to point out is on the top right-hand side, you will see a link to our YouTube channel. It's the third icon from the left. I wanted to point that out because I mentioned that today's webinar is being recorded and will be uploaded onto that channel. And it's a great source of information in case you missed any previous webinars, presentations, or videos. So let's talk about why everybody's here today, which is to learn ways to minimize the financial impact of cancer. Now, as you saw, a big part of the NeedyMeds mission is education. And we define that really in two ways. One, by educating people about NeedyMeds and the resources we offer. But the second way we fulfill that education part of our mission is by educating our NeedyMed users about other resources that will help them on their healthcare journey, which is why we are so pleased to have my friend and colleague from Triage Cancer presenting today. But before I pass the mic and the screen to her, I just want to let everybody know quickly what Triage Cancer is. Like NeedyMeds, they are also a national nonprofit. Their mission is to provide education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Really important. And their website, as you can hopefully see, is not only current, accurate, up to date, but it's really easy to navigate. So I recommend checking it out also when time allows. For now, I would like to introduce you to Amanda. Amanda Goodstedt is a staff attorney with Triage Cancer, where she works on their legal and financial navigation program, creates resources, and presents educational materials about issues impacting the cancer community. Prior to joining Triage Cancer, she spent more than a decade counseling seniors and caregivers about Medicare and related benefits. So, with that resume, you can see why we are so thrilled to have her take time out of her day to share her expertise with the Needy Meds audience. So, I'm going to go ahead without further ado and pass the mic and the screen to Amanda. So, bear with me while I do that. Now, as Amanda grabs the screen, I will remind everybody that as she presents, don't hesitate. Amanda, that came up perfectly. Thank you. Don't hesitate to submit questions to her by typing them into the questions section of that GoToWebinar control panel, and we will do our absolute best to get to as many as possible. With that, I'll pass the mic to Amanda. Thanks, everybody, for being here, and enjoy the presentation.
Thank you so much, Carla. It's a pleasure to be here, and thank you to Needy Meds for inviting Triage Cancer to present today's webinar about ways to minimize the financial impact of cancer. Before I get into today's topic, I did want to take a minute just to tell people a little bit more about Triage Cancer, in case some of you are not familiar with us. I'm only with you a short period of time today, and this way you will know where to go if you'd like to get more information about today's topic or about other topics that we cover. So as Carla mentioned, Triage Cancer is a national nonprofit that provides free education on the legal and practical issues that can impact individuals diagnosed with cancer and their caregivers. We are really proud of the fact that all the services we provide are provided free of charge, because we strongly believe that someone's financial circumstances should never be a barrier to getting important information that can help them through navigating their diagnosis. We provide education in a lot of different ways. We have a very robust website that Carla showed you a few minutes ago, and that's where you can go to get really a lot of information about the many different legal and financial issues that can arise in conjunction with a diagnosis. You will find information there about the various educational events that we host, including a free one-day conference and a monthly webinar series, as well as information about the events we participate in that are hosted by our partners in the cancer community. You can go there to download copies of all of the resources that we create. One of our most popular, there's a picture here of one of our many quick guides. These are fact sheets about popular topics, including things like health insurance, disability insurance, working through treatment, estate planning, and a lot more. We have many worksheets and checklists to try and help you stay organized. We recognize people learn in different ways, so we have non-written resources like our animated videos, recordings of past webinars, and access to our podcast. We maintain charts of state laws, and we have a state resources page, which is a great starting point to go to if you are looking for contact information for programs and services in your local area. I also want to mention that one of the handouts that Carla included today is a resource document I put together so that anytime I talk about a specific resource that we have, or you see a link to a resource on one of my slides, I pulled all of those together into one document so that they are easily accessible for you. Now that I told you a little bit about us, let's get into today's topic. I think people, unfortunately, at this point are very accustomed to hearing about the physical toxicity that is associated with cancer, whether that is toxins in the environment that are linked to causing cancer, or whether it is the toxic impact on our bodies of some of the treatments that are effective in fighting cancer. Just as there is this physical toxicity, there is also financial toxicity, the negative financial side effects that are caused or exacerbated by a cancer diagnosis. And unfortunately, financial toxicity can be every bit as significant as physical toxicity. It can also not only impact the individual who's been diagnosed, but their entire family. Now, there are certainly a number of factors that impact anyone's overall financial health, but the one that we at Triage Cancer think is the most significant contributor to overall financial toxicity is health insurance status. Do you have adequate health insurance coverage? And even if you do you know how to use your insurance effectively to minimize costs? We have found that the primary way to mitigate financial toxicity is to make sure that people are using their health insurance properly. And so that is really the focus of my presentation this morning. I don't want to minimize the fact that there are these other factors out there, depending upon someone's personal situation, that can impact their financial health. So do keep those in mind as well. So if we know health insurance status is the most significant contributor to financial toxicity, in theory, it should be easy to solve the problem. But unfortunately, one of the challenges when talking about health insurance is that it is such a complicated subject that many Americans just don't understand how it works, and they don't understand how to select a plan that will work best for them. In fact, in this survey, only 4% of people could define 4 basic terms used across insurance policies. No matter how someone got their health insurance, these are the 4 terms used to talk about cost, and 96% of people didn't know what they meant. So if you've always been wondering about what certain terms mean, or you've been confused by some of the things that you're reading, I want you to know that you are not alone. And it's my hope that by talking a little bit this morning, you will have more confidence about being able to understand a lot of these terms, and that you will feel more confident about your ability to choose a health insurance plan that will work for you. So let's start off with those terms, and let's make sure we are all on the same page about what they mean. These are terms that all relate to cost of health insurance, and they apply regardless of where you get your health insurance. So regardless of whether you have a plan through your employer, a marketplace plan, Medicare, or anything else. The first of these terms is associated with the cost of just having the health insurance at all, and that is your premium, a fixed dollar amount you pay each month. And you pay that amount whether you never go to a doctor or whether you are going to multiple doctors multiple times each month. Then we have costs that you have when you actually are using your health insurance. The first of those is your deductible. Again, a fixed dollar amount that you pay each year before your insurance plan kicks in and starts to pay for anything. Deductibles vary by plan. So to know what your deductible is, you have to read your plan language. Some deductibles are low. There are plans that even have 0 deductibles. They start paying on day 1. But there are also plans with very high deductibles. Then there is a cost each time you actually go and get health care, or each time you fill a prescription. And that cost can be expressed in one of 2 ways. Either as a fixed dollar amount, in which case it is called a copayment, or it can be expressed as a percentage, in which case it is called a coinsurance or a cost share. So if every time I go to my primary care physician, I pay $20, that's a copayment. If every time I go to my primary care physician, I pay 20% of the cost of the visit, that is a coinsurance or a cost share. The final term related to cost that I want to go over is out-of-pocket maximum. And this is, again, a fixed dollar amount. It represents the most that someone is going to pay out of their own pocket for their covered medical expenses during the year. Once someone reaches their out-of-pocket maximum, their plan takes over and pays 100% of the cost of their covered expenses for the remainder of the year. In order to know what goes into satisfying your out-of-pocket maximum, you need to read the terms of your plan. But just as an example, if you have a health insurance plan you purchased through your state's marketplace, excuse me, when figuring out whether you have satisfied your out-of-pocket maximum, you look at all the amounts you have paid towards your deductible, all of your copayments, and all of your coinsurances. So I want to go through a quick example of how this works. Meet Dan. Dan purchases an individual health insurance plan through his state's marketplace. His plan has a $2,000 deductible. It is structured as an 80-20 coinsurance. So the plan pays 80% of costs, the individual pays 20% out of pocket, and the plan has an out-of-pocket maximum of $8,000. If Dan ends up in the hospital at the beginning of the year with a whopping $102,000 hospital bill, what is he responsible for paying? So the first $2,000 is Dan's deductible. He has to pay that. That leaves us with $100,000. And his plan is an 80-20 cost share. 20%, his responsibility should be $20,000. But that is not the end of our analysis. Because Dan's plan has an out-of-pocket maximum of $8,000, the first $2,000 he paid towards his deductible is subtracted from $8,000 to leave us with $6,000. So of the remaining $20,000 of that bill, Dan is responsible for paying $6,000. In total, across the year, he's paid the $2,000 deductible plus the $6,000 for an $8,000 total coming out of his pocket. Now, I'm not suggesting $8,000 isn't a lot of money. Of course it is, but it is still a lot less than $20,000, let alone $102,000. So if you find this example helpful, and you want to hear it again, or maybe you know someone who you'd like to help better understand this, the example is in one of our animated videos. It's in the one about health insurance basics. Now, a few additional notes about out-of-pocket maximums. There are some nuances to this. The first is, in my example with Dan, I told you that he purchased an individual health insurance policy, but of course we know that people also have family health insurance policies. In the case of a family plan, you may be looking at individual out-of-pocket maximums for each covered family member, as well as a family out-of-pocket maximum. I also mentioned that Dan purchased his plan on his state's marketplace. By definition, marketplace plans define out-of-pocket maximum as including amounts spent for the deductible, for all copayments, and for all coinsurances for both medical care and prescription drugs. However, not all plans define out-of-pocket maximum in that way. And in fact, not all plans have out-of-pocket maximums. So you need to look at the terms of your plan to know what your plan's out-of-pocket maximum is and how it's defined. If you have an employer-sponsored plan, for example, it might not include amounts spent towards your deductible. It might only look at copayments and coinsurances when it comes to satisfying your out-of-pocket maximum. It might not look at copayments either. It might only look at coinsurance amounts. And it might not include amounts you're spending on prescription drugs. Sometimes plans, even if they cover both medical care and drugs, will have separate out-of-pocket maximums for each. Finally, there could be a separate out-of-pocket maximum for out-of-network services, which brings us to a few other terms that are good to know. Most health insurance policies have networks of providers that the insurance company has contracted with to provide services to its members for set rates. Those rates are called allowed amounts or contracted amounts. The providers could be doctors, groups of doctors, hospitals, therapists, labs, pharmacies. And essentially, if you go to providers within your plan's network, you are charged the allowed amount or the contracted amount. However, if you go to providers who are not in your plan's network, then your insurance policy may not cover the services at all, or it may cover them, but at a different rate and typically a higher rate. Another term to be familiar with when it comes to your health insurance is prior authorization. This refers to an insurance company requiring someone to go to them before they receive services and essentially getting approval that the insurance company will in fact cover whatever service is in question. There are a number of challenges that come with prior authorization, one of which being it's not always called the same thing. So sometimes it's called pre-authorization or pre-auth or advance approval, essentially lots of different names for the same thing. So be on the lookout if you hear phrases that have this meaning of getting approval before you're allowed to get care. Unfortunately, most insurance companies don't provide a comprehensive list of every single time someone is going to be asked to get prior authorization. Sometimes it is more common to see this requirement when a service is going to be more expensive, something like a surgery or an expensive test. Sometimes it's requiring it in order to have a hospital admission, or you might need it. The concept, just as it exists with respect to medical care, exists with respect to prescription drugs. So you could have a really expensive specialty drug that requires prior authorization before it's filled at your pharmacy. It is the patient's responsibility to get prior authorization. Sometimes your doctor or your healthcare provider will be helpful and facilitate this, and that is great. But ultimately know that it is your responsibility in the end to get this prior authorization, or you are risking the insurance company denying coverage. Unfortunately, we have seen situations where even when you get prior authorization, it doesn't guarantee coverage. But I do want you to know that you can appeal the denial of a prior authorization, just like you can appeal the denial of coverage after getting a service. A couple of other things to be aware of when it comes to the cost of health insurance. These couple of terms relate to billing. Sometimes I hear surprise billing and balance billing used interchangeably. These terms do not mean the same thing at all. So I want to just clarify what the differences are. With balance billing, I'm going to start at the bottom of the slide. Balance billing refers to billing a patient for the difference between what a healthcare provider charges and what the insurance company will pay for an out-of-network service. Balance billing is only relevant for out-of-network services because if you are seeing an in-network provider, they are not allowed to balance bill. They are obligated to take that allowed amount or contracted amount that's already been agreed upon with the insurance company. So a quick example, if your provider charges $100 for a service and the allowed amount is $70, if you're seeing a preferred provider or an in-network provider, they can't bill the patient for that $30 difference. If, however, you've gone to an out-of-network provider, they can bill the patient for the $30 difference. That's balance billing. Let's go back to surprise billing. Surprise billing is for a situation such as the following. Patient does all their homework, they know they need surgery. They select a hospital where they're going to have the surgery, and that hospital is in network. They choose a surgeon to perform the surgery who is in network. They are admitted to the hospital, they have the surgery, they need anesthesia during the surgery. They didn't interview or select the anesthesiologist. That person's assigned by the hospital based on who's on call. And then post-discharge, the patient winds up with a bill from the anesthesiologist only to find out that that person was not in network. That is what we refer to as a surprise bill. So for a while now, a number of states have had laws protecting patients from bills in these situations. There are a bunch of other states that have had partial protection for surprise billing, usually in the context of emergency room visits, where again, patients didn't really have a choice about who was seeing them when the emergency arose. But we have some good news on the federal level. At the start of this year, from the start of this year, pardon me, we have a new federal law, meaning it's the law in all 50 states, called the No Surprises Act. This law applies to situations like the one I just described, where someone is getting non-emergency medical services at an in-network facility, but wind up with bills from providers in the facility who were out of network. It also applies to emergency medical services. It covers air ambulances, although it does not cover ground ambulances. And it requires that private insurance treat surprise bills in these situations as if they came from in-network providers. Now, there's some other provisions in this act. One of them does allow an out-of-network provider, if a patient is seeking non-emergency care, if the provider is out of network, they can ask a patient to waive their rights under this law. And if the patient refuses, the provider does not have to provide care. However, providers cannot ask people to waive rights in situations where there is no choice, where they were the only option. Situations like the anesthesia example, pathology, certain diagnostic services. The government has set up a no surprises help desk, since this is a new law and there may be confusion on the part both of patients who are unaware of the law and also on the part of healthcare providers who are adjusting to it. So if you have a question about a bill and you think that it has been mishandled, you can either call the 800 number or you can submit an inquiry online at the website that you see on the slide. One final slide I want to go through regarding these basic terms that people should know. This one is all terms related to prescription drug coverage. The first thing people should know is a plan's formulary. And formulary just means a list of the drugs that are covered by your insurance policy. Formularies are broken down into different levels or tiers. The number of tiers differs by plan. There's no magic number. But the general rule is that the lower numbered tiers are where you're going to find your less expensive drugs, drugs like generics, and the higher numbered tiers are where you're going to find more expensive drugs, excuse me, including newly approved drugs or the types of specialty drugs that are common for treating cancer. There is no requirement that every drug be on every plan formulary. And you should know that if you seek to fill a prescription for a drug that is not on your plan's formulary, you are responsible for 100% of the cost of that drug. And any amounts you're paying are not going to count towards satisfying your deductible or out-of-pocket maximum. So now that I covered all of these terms that are important, regardless of how somebody gets their health insurance, I just want to remind everyone about where it is that people get their health insurance. So in the United States, there are three main places that people look for health insurance. The first is through an employer. That might be insurance through your own employer, through a spouse's employer, depending upon age, through a parent's employer. It might be retiree coverage through a former employer or union. It might be COBRA continuation coverage even once you've stopped working. The second major place that people look for health insurance is through the government. This could mean Medicare, it could mean Medicaid, Veterans Health or other military insurance, the Indian Health Service, or some state or local plans. The third major place that people go to for health insurance is privately, directly from an insurance company. And this is actually where the marketplace would fall, because even though those marketplaces are regulated by the government, they are places where people can go to purchase individual health insurance plans directly from private companies. At Triage Cancer, we believe that it is important that you know all of your health insurance options so that you can do your best to choose the one that will work for you. A lot of people don't realize that they may even have options. They might only know about one option. Unfortunately, I don't have enough time today to get into a lot of detail about all the options, but know that we do have extensive resources to help you try and understand them. So we have resources about COBRA and details about the marketplace and Medicare and Medicaid and all of these programs. And I want to highlight 2 webinars we did earlier this fall. Recordings are accessible through our website. The September webinar is an in-depth look at Medicare, and the October webinar gets into a lot more detail than I'll be able to today about the marketplace and about Medicaid. In addition to knowing what your options are, you also need to know when you can take advantage of an option. When are you able to enroll, or when are you able to make a change to your coverage? So with respect to employer plans, this is going to vary. It's going to really depend on what your employer has set up with your insurance. It's often in the fall that you can make changes, but not always. So our suggestion is to go to your human resources department or whoever handles benefits at your company if you have questions about when your open enrollment period would be. When it comes to Medicaid, which is the government program providing health insurance for people with low incomes and or low resources, Medicaid takes applications all year round. So if at any point during the year you need health insurance coverage, you think you may be eligible for Medicaid, you can go ahead and apply. Medicare, which is the government health insurance program for people who are age 65 and older, for people under 65 who have been receiving Social Security disability benefits for 2 years, that program has an annual fall open enrollment period. It actually started recently. It began on October 15th. It continues through December 7th. This is the time of year when anyone with Medicare can make changes to how they get their Medicare coverage. When they make a change during this time period, the change is effective on January 1st of the following year. So right now, if you're making a change to your Medicare coverage, it will be effective for calendar year 2023. With the marketplace, they also have an annual fall open enrollment period. It is coming up next week. For most states, it is November 1st through January 15th. Although if you want your coverage to be effective January 1st, you need to enroll by December 15th. Some states do have the flexibility, or states have the flexibility for longer enrollment periods, and some states have taken advantage of that. So you should always check your state's resources to see if the enrollment period dates vary. Now, once you narrow down your plan options and once you know when you can enroll, you need to know how to compare options. So I want to walk you through an exercise to compare costs. This exercise is useful if you're comparing to marketplace plans, maybe you're comparing to employer options, maybe you're comparing an employer option to a marketplace option. You could even use this type of analysis to compare Medicare Advantage plans. I'm going to use 3 marketplace plans for my example. I try to keep the math relatively simple. So I'm going to compare a bronze plan on the marketplace with a $200 monthly premium, $6,000 deductible, and $8,000 out-of-pocket maximum. I'm going to compare a silver plan with a $275 monthly premium, $2,500 deductible, and $6,000 out-of-pocket maximum, and a platinum plan with a $400 monthly premium, no deductible, and a $2,000 out-of-pocket maximum. Now, our goal when we compare costs is to compare total possible cost for the year. And when we're talking about the cost of a cancer diagnosis, likelihood's pretty high that we're going to hit our out-of-pocket maximum. So we're going to make that assumption when we do this comparison. And we're going to try and figure out, by looking at these plans, how much are they actually going to cost by the end of the year, and which of these options is going to cost the least. And when I do this program where I can talk face-to-face with people, I will ask them, can we tell just by looking at this slide, which is the cheapest plan, which will cost the least overall? And the answer is no. We can't tell just by looking. We actually have to do some math. Remember, our goal is selecting the plan with the lowest total cost for the year. To do that, here's the math that we're going to do. We're going to multiply the monthly premium for each of these plans by 12. because we know that that is a fixed cost. We have to pay our 12 months worth of premiums. But then we need to add to that the out-of-pocket maximum for each of these plans. When we do this math, our bronze plan totals at $10,400 for the year, our silver plan at $9,300, and our platinum plan, the one with the fanciest name, the one whose monthly premium is double that of the bronze plan, totals out at $6,800, more than $3,000 in savings over the bronze plan. I will tell you that after many years of working with folks on selecting health insurance plans, there is a tendency among people to focus a lot on premiums. And I understand that. Your premium is that fixed amount and you are paying it no matter what happens. But premiums only tell part of the story. Remember that slide that I took you through with the terms that most Americans aren't able to define? Premium is only one of several terms that talk about cost. It's important to do this math and find out overall cost, not just focus on one element of it, in order to really see how to save money. Now, doing the math is incredibly important, but comparing plans isn't just about cost. Cost is step one, but we have other steps to go through also. Step two is going to be looking at providers. Are the doctors you want to see, are the facilities where you want to be treated in network for the plans that you're considering? If they're not in network, does the plan offer any network coverage and at what rate? Another really important step is comparing prescription drug coverage. Are the drugs you take covered by the plan you're considering and at what cost? In addition, even when drugs are covered on a plan's formulary, plans can place restrictions on those drugs. So a plan could have a prior authorization requirement. They might have quantity limits, or they might have step therapy requirements, which basically means that someone needs to show that they have tried a less expensive drug to treat the same condition and that that less expensive drug hasn't been effective before a plan will approve a more expensive drug. Know that if you are working with the marketplace website does allow you to see which providers are part of which plans, as well as what prescription drugs are covered. A couple of tips for this. One is to always double check with your providers. And this goes for whether you're looking at marketplace options or other types of options. Call the provider's business office or check their website, see what their listed insurances are. Another suggestion is to make sure you are using specific plan names when you are searching. On my slide, the example is don't use Obamacare. That's kind of an obvious one, but also it won't be enough to just type in Humana or Blue Cross or whatever insurance plan you're thinking about. Those are company names, but each of those companies has hundreds of insurance products. So be very specific in making sure that the specific plan you're looking at from one of those insurance companies is one of the accepted plans from your providers. Also, if you do make changes during open enrollment, let your providers know that you're changing insurance in order to try and smooth out the transition. It can sometimes feel like selecting the right plan is easier said than done. This is so important to your finances that we have created several resources just around this concept. So all the information I just discussed is in an animated video. We also have a worksheet where all you have to do is fill in the blanks and we help you with the math to do the type of analysis that I just did in my exercise. I love this worksheet. It's great for people like me who are not math people and who really want to be led through all of this step by step. I also want to note that unfortunately, choosing a health insurance plan is not a one and done exercise. You have to continually review your coverage at least once each year. Your circumstances can change. Maybe you stop working, maybe you change jobs. Your health situation may change. Perhaps you go from not needing treatment to needing it again. But even if you keep the same insurance, and even if your circumstances are the same, and even if your health situation is stable, insurance policies can change their costs and their coverage from year to year. So it is super important to stay on top of this and make sure that you are routinely double checking that something that was best for you in the past continues to be best for you going forward. So while I'm not able to get into a ton of detail about each of the different types of coverage today, I did want to note a couple of important things about marketplace coverage. One of the benefits of purchasing a plan through your state's health insurance exchange is, as I talked about earlier, that there are stated out-of-pocket maximums. This year, the individual out-of-pocket maximum is $8,700 for an individual and $17,400 for a family. In 2023, those amounts are going up a little bit to $9,100 and $18,200. Another benefit to the marketplace for saving money is that there is financial help available for some people with the cost of their coverage. There are two types of financial help. The first is premium tax credits. Those help reduce the monthly cost of purchasing insurance by reducing your premiums. And then there's cost sharing subsidies, which are reducing costs like your co-payments and your co-insurances when you're actually getting your health care. Whether or not you are eligible for financial assistance is determined by your household size and your household income. So based on those two factors, this chart is showing you, depending on where your household falls, whether you would be eligible for pre-tax credits, cost-sharing subsidies, or both. Note that cost subsidies are only available if people choose what are called the silver level plans. Also note that this chart is showing what happens in those states that have expanded the Medicaid program. There are 12 states that have not expanded Medicaid, and in those states, when you see the shorter blue arrow at the bottom of the chart, that arrow would not exist in those states. In those states, Medicaid is not generally available to people solely because their income is under 138% of the federal poverty level. Last year in 2021, as part of the American Rescue Plan Act, enhanced subsidies were passed that increased help for people who were already eligible for help and expanded subsidies to some of the people who were not previously eligible. And thanks to the Inflation Reduction Act that was passed earlier this year, that help is going to continue through 2025. In addition, people whose household income is above 400% of the federal poverty level will be able to reduce their monthly premium costs of insurance on the marketplace to 8.5% of household income. That was a lot I just went through in a very short time, and there's a lot more to this chart to unpack and to understanding the marketplace and Medicaid. So I want to point you to our September webinar that I mentioned earlier. There is a recording of that on our website where we get into a lot more detail about both the marketplace and Medicaid, and we explain a lot more of how this chart works. I also want to highlight that if you are interested in a marketplace plan and you need support to compare plans, there are people in your area who can help you. They are called assisters, and they are trained and certified and required to provide fair and impartial information. A lot of people go to insurance agents or brokers to help them with these decisions, and there's nothing wrong with that. Agents and brokers can be very good at their jobs and very knowledgeable. Just be aware, though, that they will have, agents and brokers have a financial interest in the product that you select. Assisters do not. They are totally neutral, and so you can locate one by using your healthcare or health insurance marketplace website. Since we're in the middle of Medicare's open enrollment period, I wanted to say a couple of things about Medicare. It is a complex topic, which we could talk for hours about, so I'm going to try and give an incredibly short version of it. But with Medicare, you essentially have two lanes you can drive down to get your coverage. The first of those lanes is original Medicare, where you have Medicare Part A providing hospital insurance coverage and other inpatient coverage, and Medicare Part B, which we think of as medical insurance for doctor's visits, labs, tests, other outpatient medical care. If you want prescription drug coverage, you have to select a separate Medicare Part D drug plan. And if you want help with some of the out-of-pocket costs of Medicare Parts A and B, because Medicare A and B do not have out-of-pocket maximums, you can also purchase what's called a Medigap, or a Medicare supplemental plan from a private insurance company. That's lane one. The alternative to that is lane two, Medicare Part C, or the Medicare Advantage program. Private managed care plans that include the types of benefits that you would otherwise be getting from original Medicare. Usually these plans also include drug coverage, but if you have selected a Medicare Advantage plan that does not, you can pick up a separate Medicare Part D drug plan. What you can't do in lane two is get a Medigap plan, and that is because Medicare Advantage plans have out-of-pocket maximums. We have developed a Medicare comparison worksheet. This is similar to the worksheet I highlighted a few minutes ago that you can use with employer-sponsored coverage and marketplace coverage. This worksheet is specific to Medicare because there are some special nuances to how to compare pricing in Medicare. And the webinar that I mentioned that we did in September goes into some more detail about how to use this worksheet. A couple of other interesting things to note about the Inflation Reduction Act as it concerns Medicare. The Inflation Reduction Act has brought in a number of exciting consumer-friendly changes. They're not all going to become effective all at once. Some of them are a little ways out in the future. In 2024, the 5% catastrophic coverage payments that are presently required in Medicare Part D, if you get to that point in coverage, will be eliminated. In 2025, we are going to see an out-of-pocket maximum for drug costs. It's going to start out at $2,000, although that amount may increase over time. If you are paying a deductible in your drug plan, the amount you pay towards the deductible is going to count towards that cap. And that cap's going to exist whether you have a standalone Part D plan or whether you get your drug coverage through a Medicare Advantage plan. Also in 2025, Medicare Part D is going to start smoothing out some of the cost sharing that people are obligated to pay. So if you owe a big amount of money, rather than paying in a lump sum, it will be spread out more evenly during the year. Starting next year, thanks to the Inflation Reduction Act, co-payments for a 30-day supply of insulin are going to be capped at $35. And vaccines that are covered under Part D, like the shingles vaccine, which in the past has been somewhat expensive, will have zero cost sharing. Finally, in an attempt to make sure that insurance companies don't completely raise their premiums because of all of these consumer-friendly changes, the Inflation Reduction Act has said that between 2024 and 2029, Part D plans cannot increase their premiums by more than 6% each year. So this may have been the fastest discussion of Medicare I've ever had. And so if you want more information on Medicare, we do have a brand new resource hub on our website where you can access all of the quick guides, animated videos, the comparison worksheet, and everything else that we have done on that topic. So at this point, I've gone through information about comparing plan options. I talked a little bit about the marketplace and about Medicare. And hopefully a lot of what I've discussed with you is going to help you in selecting a plan that works for you. The reality, though, is that even if you have adequate health insurance, it's not going to completely eliminate all of your medical bills. So I want to quickly just go through some strategies for managing those. Every time you get healthcare, you usually get a flurry of communication. Some of that is from your insurance company. The most important thing I think you're going to get from your insurance company is called your explanation of benefits. This screen is just an illustration of the types of information you're going to find on an EOB or an explanation of benefits. It will highlight the fact it is not a bill. It is a communication from your insurance company summarizing what the provider billed them for and what they think they're responsible for. It will have information about your policy number, member number, basics of that nature. It will summarize what the insurance company was billed for, what they approved, and what they think that you may owe your provider. It will also get into some detail about the date of the service, who provided the service, how it was coded. It will go through what the insurance company was charged, what they allowed, and what they paid, as well as a breakdown on your end, what has been applied to your deductible, what may have been a copayment or coinsurance, and what has not been covered. A good EOB will also keep track for you of where you are at that point in the year towards meeting your deductible and any out-of-pocket maximums. In addition to communication from the insurance company, you're going to get communication from your provider. That's generally the bill. Unfortunately, it doesn't always happen in this order. Usually the providers are faster with the bills than the insurance companies are with the EOBs. We strongly suggest waiting for EOBs before you pay any bills so that you can match them up and make sure you understand how claims were processed. Very important to review bills for accuracy and not be afraid to ask providers for clarification. Important to review your EOBs. If you are feeling like you can't do this, see if there's a friend or family member who maybe can help, someone who's been out there saying, how can I help you? I really wish there's something I could do. Maybe the something they can do is help you go through a stack of mail and match up your bills and your EOBs. There are professional organizations if there is no one in your life who can help you with these things. And remember to appeal denials of coverage. People are really reluctant for some reason to appeal. Health insurance companies deny a lot of claims, and a lot of those claims are overturned even with one level of appeal. It is really important to know for purposes of appeals what kind of health insurance plan you have, because the appeals process varies depending upon how your insurance is provided, as well as upon your specific insurance company's rules. Find out the reasons for denials. Sometimes they're administrative, sometimes it's more complicated and an insurer is questioning whether something's medically necessary. If it's a medical necessity type of situation or anything else medical, get your healthcare provider involved with an appeal. They can be the critical difference in being successful. Appeals are complicated, and this was like a very quick overview, but know that we do have resources on our website to help you if you have questions about the appeal process for your type of insurance. Also know that if you're in a situation where you do legitimately owe money to the healthcare provider, you can try talking to them. You can try negotiating. Better to do it sooner rather than later before unpaid bills get sent to collection agencies. But you can flat out ask for a provider to write off amounts of a bill, to negotiate payment plans, to give you more time if you are just waiting on, a paycheck or something else happening, and potentially taking lower lump sum payments in exchange for foregoing getting paid out over time. Make sure you keep records of medical bills, records of all the correspondence from your insurance companies. Pre-authorizations are especially important. Take notes. I usually like to recommend that people keep a small notebook and a pen with them when they have any telephone conversations. Jot down dates, names of people you speak to, and the outcomes of any conversation so that you can go back and demonstrate what you've relied on if problems come up in the future. One other new resource we've developed that I want to highlight is our medical bill tracker. You can download this from our website. It will open as a Google Sheet. What this is designed to do is help you keep track of where you are in terms of meeting your deductible and out-of-pocket maximum for the year. You can fill in at the top your deductible, your out-of-pocket maximum. Then at the in the grid part of the spreadsheet, you can take notes on what bills you've received and the amounts that have been paid. And the worksheet is programmed to calculate what is remaining in order to satisfy your deductible and your out-of-pocket maximum. So we're hoping that that will be a useful tool if you, in particular, have an insurance company that doesn't keep track of that for you on your EOBs. Another piece of good news this year, a consumer-friendly piece of news, is that in March, the three main credit reporting agencies announced that as of July, paid medical collection debt was no longer going to be included on their credit reports. And also they were extending the period of time before unpaid medical collection debt appeared on the reports at all. It used to be 6 months, now it's up to a year. Another change coming in 2023 is that certain amounts of medical collection debt won't be included on credit reports at all. It is said that this action by the credit reporting agencies is going to remove nearly 70% of medical debt and collections from people's credit reports. Research has shown that medical debt is less predictive of someone's ability to repay loans than other kinds of loans. So this is all really, it's great news for consumers. I just want to close with a couple of other notes about some resources we have. Cancer Finances is a tool we developed to give practical information on topics that can impact your finances. You select a module of interest, and I want to highlight that we do have a financial assistance resources module where we have curated information about a lot of organizations that provide direct financial assistance, because sometimes even if you do everything you can to choose the right health insurance and to try and negotiate bills, people, of course, always find themselves or often find themselves still needing more money than they have. And so we try to point people in the right direction in terms of the resources that are out there. We are grateful to have our partnership with Needy Meds, and we highly recommend using their drug discount card. You can download it from our website as well as theirs. You don't have to register. Hopefully everyone here has one. But this is another possibility if you are taking a drug that is covered by their program and available at one of the pharmacies that's in their network. And finally, I just want to talk about one of our newest resources, which is our Legal and Financial Navigation Program. We recognize that sometimes you can do a lot of homework on your own and not get an answer to a question that you have. So we do have this program where we provide free one-on-one help to people diagnosed with cancer, caregivers, and healthcare professionals on a variety of topics. Best way to get started with us is to go to our website, fill out a brief intake form. You'll be led to being able to schedule a phone call from a staff member at a time that works for you. We will call you, ask you questions, try to go through options you may have, do our best to give you accurate information, all with the hope of empowering you to take next steps. So if during my talk today you have questions coming to mind of a more personal nature, I invite you, please reach out and make an appointment. And with that, I'm going to turn things, I think, back over to Carla. I don't know if we have time for any questions or how she wants to handle that.
Thank you so much, Amanda. I mean, I really have to say, as always, I am blown away. I really am. This is one of the reasons that we are so proud of our partnership with Needy Meds, because Triage Cancer takes these huge topics and these confusing issues, such as choosing a healthcare plan, and breaks it down into language that is defined and understandable. One of the things, in addition to all of the information Amanda shared and explained, she did pepper her presentation, and I'm so glad she did, with additional resources, materials, and educational events that Triage Cancer has. She totally understands, as she also said many times, that no matter how simply these topics are broken down, it's still a ton of information. So I encourage you to regularly check out the Triage Cancer website. And the reason I say regularly is because you can head to that destination today, and I'll show you what that looks like right now. I just want to put up their website as we talk about it. One of the reasons I say on a regular basis is because the other thing that you may notice that Amanda said quite a bit is she wanted to point out a new resource. They are always listening to the feedback of their users. They're always thinking about what is most needed. And something that is not easy to do, but they make it look easy, is they stay up to date on changes when it comes to healthcare, Medicare, and Medicaid. Again, not an easy thing to do. So regularly check out that website because things change all the time. And when they do change, you can rely on Triage Cancer to have the most accurate and current information. So, Amanda, thank you so much. And the feedback I'm getting from our audience shows that they are just as impressed as I am with your presentation and how much we were able to cover how much you were able to cover. As Amanda said, we don't want to take up too much of your time, so we're going to get to just a couple of questions that came in for her quickly. Before we do that, I just want to remind everybody that Needy Meds is also here as a source of support. What you're looking at are our most popular healthcare savings resources. If you'd like to learn more, visit our website, call our expert call center counselors, or join us for one of our monthly overview webinars. So let's get to those questions coming in. I did remind everybody that you can type questions into the questions section of your GoToWebinar control panel, and I do see some coming in. For some of you, though, heads up, it may actually be the chat section. As promised, as I have Amanda get to those questions coming in from our audience, and Amanda, I will share we're getting a ton of thank yous as well. I want to put up the contact information for Triage Cancer. It's triagecancer.org. Their phone number is 424-258-4628, and you can always reach out to them via email as well, which is info@triagecancer.org. So Amanda, let's get to a couple of questions that came in. This first one, you talked about marketplace assisters. I love this question because I bet it's one you get a lot. This individual is sharing that she has Medicare. She wants to know, can assisters help her figure out whether a Medicare Advantage plan she's considering is a good idea? Great question.
So thanks, Carla. And that is a great question. And I'm glad you brought it up because I didn't have a slide about this with Medicare, but assisters are there to help with the marketplace. However, if you need one-on-one assistance selecting a Medicare Advantage plan or just comparing Medicare options, every state has what is called a SHIP program, a state health insurance assistance program. Some states call them different names. But these programs, what they have in common is they are volunteers who provide free, neutral advice or assistance to Medicare beneficiaries in making choices about their Medicare coverage. In order to find contact information for your state's SHIP program, you can go to Triage Cancer's state resources page. You see a big map of the country. You click on your state, and you'll be led to a landing page where under Medicare, you will see the name of your state's SHIP program and contact information for it. And I highly recommend them as a resource, just as I recommend assisters, because again, these are folks who are trained. They are very knowledgeable about, in this case, Medicare, and they are not brokers or agents. So they don't have any financial interest in the information that they're giving you or in the options that you select.
Such a great question, and thank you for the easy to understand answer, Amanda. I'm going to ask you another question that came in from an audience member. I'm just read it to you the way it came in. This audience member is sharing, I checked that one of the prescription drugs I was just prescribed is on my plan's formulary, but the plan is still giving me a hard time about getting it. Unfortunately, something we can all relate to. The pharmacist told me she has to wait to talk to the plan. why is that the case if it's covered?
So I can't say for sure because I don't know all the details, but my guess about this is that it is an instance like the ones I talked about with prior authorization. So again, you can have drugs covered on your plan's formulary, but still have the plan impose restrictions on getting those drugs. And so sometimes what a plan will do is say you need prior authorization, which results in you going to the pharmacy, handing the prescription to the pharmacist, and the pharmacist, rather than just being able to fill it the way they would with other drugs, they have to first call the insurance company and get what is called prior authorization. So that may be what's happening here. If you want more details, or you want to sort of share more about what's going on, this might be an instance where our legal and financial navigation program could be helpful for you.
Wonderful. Thank you so much, Amanda. And thank you to our audience for participating. I say this regularly in our webinars that if one person is asking it, we hope that or thinking it, we hope they do ask it, because the chances are other people have the same question. And it also gives our presenters an opportunity to share even more of the information they have. One quick question I'm going to go ahead and wrap it up with, which is a question about affording medications and how to begin a search on Needy Meds. So I'm going to keep this really brief. Again, if you'd like to learn more about how to navigate our website and all of the resources we have, join us for a monthly overview webinar. For now, I'll show you the easiest way to go about it. So this is needymeds.org. It also gives me an opportunity to let everybody know we are in the middle of a fundraising campaign. So if you have any room in your budget as a nonprofit, please go ahead and donate. You could do that by clicking on the Donate Now on the top right of our homepage. Any dollar amount that you can spare does make a difference. So anyway, let's talk about how you would find healthcare savings for a particular medication. The easiest way to go about it is you will notice that on our, let me make this a little bit bigger. On our website, on the top left-hand side, you will see a drug search field. You can simply type the name of the medication into, whether it's brand name or generic, into that drug search bar, and the site will automatically bring you to a page that lets you know all of the cost savings programs related to that medication. You can also look for specific categories under the healthcare savings tab, or if you'd rather speak to a live person, if you don't have the luxury of having the internet at your fingertips, don't hesitate to reach out to our call center counselors, 1-800-503-6897. Thanks so much for giving me the opportunity to just point everybody in the direction of how to find what they need on needymeds.org. So with that, as I said, we do want to keep the question segment brief. So if you asked a question and we didn't have a chance to answer, we will follow up with you by email. But if you do need an immediate response, don't hesitate to reach out to Triage Cancer directly or Needy Meds, and you can find that information on the screen right now. A big thank you to everyone for making the time to join us for today's presentation. And of course, a thank you to Amanda for sharing all of her expertise with the Needy Meds audience. Have a great day, everyone, and we do hope to see your names pop up in future webinars. Take good care. Thank you.